talk about geographic distribution, it tends to be more prevalent in the developing countries of the world. And where do you find them? Asia Pacific region, Sub-Saharan Africa, and Central Asia. And this is so because some of the cultural practices in those parts of the world probably encourage the transmission. We'll still talk about how it's transmitted. The prevalence in Nigeria is high. Nigeria is regarded as one of those countries in which the virus is endemic. By the time you have a prevalence greater than 8%, it points towards endemicity. Okay, so you can see prevalence of 8 to 12%. Now, the virus, there's something we call about the incubation period. It's the period between when the virus or an organism enters the body and the period when the person begins to manifest the first symptom that you can attribute to the organism. In this case, we are talking about hepatitis B. It has an incubation period of 30 to 180 days. So once somebody gets in contact with it, it's not immediately that the person may manifest symptoms. It may take a period of 30 to 180 days. And it's interesting to know that hepatitis B virus is actually 100 times more infectious than HIV. Okay, and 50 times more infectious than hepatitis C virus. And it can survive outside the body for at least 7 days. Okay, unlike HIV that dies within minutes outside the body. So if there's a blood that is infected and it's on a it contaminates the body surface, it can still infect people, anybody that comes in contact with that surface, especially if there's an open wound, so the virus can get in through that. So the modes of transmission, especially in our own environment, means the body surface, even saliva. Okay, so it's been identified in different body fluids. And we also talk about child to child, even saliva. Okay, so it's in body fluid. And and that's why the virus can occur in clusters in families. Okay, children at a young age, very early in life, when they at the playground, they can, when the child is infected, transmission, that's what we call horizontal transmission. Because when there's an open wound, for instance, that baby, while playing with an instrument you are using, and you use that instrument on another person who is not infected, ultimately, you put the instrument you are using, and you use that instrument on the infected person. Okay, so that's what all these ones they call horizontal transmission. So blood transfusion, and that's why we screen potential blood donors. So the virus can be transmitted if you give the blood of an infected individual to a recipient. So that's why we screen for not only hepatitis B, but C and HIV before we transfuse. Then, of course, sexual transmission is there. Organ donation, it's important that individuals that also want to donate organs should be screened, because you don't want to receive organs from somebody who has the infection. Majority of infected persons are without symptoms, and that's also the scary part, okay? So there's no way, it's not written on the face. Just like they say HIV, they show for face. So the same thing. Infected persons are without symptoms, and that's also the scary part, okay? So there's no for face. Doesn't show yet of individuals. At that, there's in some persons there's ongoing damage, even though they don't have symptoms. And by the time they have symptoms, it's often too late. At that stage, they may require a new liver. So that's the essence of this awareness that we must know about the liver diseases that are quite common in our environment. So, and when cirrhosis occurs, cirrhosis is a pre-malignant condition. It means that anybody, once cirrhosis are setting, whatever has caused that cirrhosis, even if you have taken care of it, that liver continues to be at risk of developing cancer. Next slide, please. Okay, so a little bit on chronic viral hepatitis C. The global prevalence is not as prevalent as B, so it's about 50 million people living with chronic hepatitis C. Approximately 1 million new infections occur every year. And in year 2022, an estimated 242,000 deaths were attributed to hepatitis C, primarily again from cirrhosis and liver cancer, according to World Health Organization. But the interesting thing about hepatitis C now is that we have potent drugs that can achieve cure in at least 95% of individuals. But the problem we also have now is access to the drugs, especially in the low and middle income countries of the world, where there's poor health insurance, and then people have to pay low and middle income countries of the world, where health insurance actually, unlike B that has a potent vaccine, hepatitis C has no effective vaccine. So there's no vaccine that we can give that can protect against hepatitis C. Whereas for B, there's a potent vaccine. So there are high-risk groups, especially those that inject drugs. There are some people we call intravenous drug abusers that share needles and syringes. So these people are at high risk. Then also the people that indulge in this practice of tattooing. Okay, these individuals may be at risk of getting hepatitis C. But there are some other emerging high-risk groups, including men who have sex with men, individuals exposed to tattoo practice I mentioned, and then newborns of infected mothers. So the WHO has elimination goals with regards to hepatitis C. And the goal is that hepatitis C should be eliminated by 2030. But this requires significant progress in diagnosis, treatment, and prevention of hepatitis C. Aflatoxin, I think I've mentioned it briefly, family of toxins produced by certain fungi that are found on agricultural crops such as maize, peanuts, cottonseed, and tree nuts. Okay, the name of the parasites are there. The WHO has declared aflatoxin a global food security concern. Next slide. So what are the health impacts of aflatoxin? Large doses can cause acute aflatoxicosis, which is characterized by liver damage. Okay? When there's liver damage, there's nausea, vomiting, abdominal pain, convulsions, and it could be fatal, particularly in children. Then if somebody has been chronically exposed to aflatoxin, because long-term exposure has been linked with increased risk of having liver cancer, even increased risk of growth retardation and then cirrhosis. Aflatoxin is also been shown to cause damage to DNA, okay, potentially leading to mutations that can also increase risk of developing cancer. Now, the other leading cause of chronic liver disease worldwide is alcohol, okay? And there's growing concern due to increasing use of alcohol. A lot of people are indulging more and more in drinking alcohol. And the quantity and the duration of alcohol intake is actually important. For individuals who consume 50 grams per day or more of alcohol for more than 10 years, they are at risk of having alcohol-related liver disease. How do you calculate the grams? Okay, for most of the beers we have around, they have like 5% of alcohol if you look at it. So, and then most of these beers are 60 cl, that's 600 mils. So a bottle of beer, by the time somebody consumes a bottle of beer, he or she has consumed 30 grams already. So consuming 2 bottles of beer, that's already 60. So imagine somebody taking daily consumption of more than 2 bottles of beer. That person will be at increased risk. And of course, females are more predisposed to the harmful effects of alcohol. Daily drinking is more daily drinking is more dangerous than intermittent consumption. And of course, the way alcohol causes damage to the liver is first that it first allows fats to be deposited in the liver, which we call fatty liver. If nothing is done, it progresses to hepatitis, what we call alcohol-related hepatitis. What it means is that the liver begins to react to the presence of the fat in its cells. And it's that reaction that is called inflammation. So at the stage of fatty liver and at the stage of alcoholic hepatitis, you may actually be able to reverse the damage if the person abstains from alcohol. However, if alcoholic hepatitis goes on unabated, it progresses to cirrhosis. And once cirrhosis occurs, it means the damage is irreversible. So we must do everything in our power to prevent cirrhosis from happening. So there's the other entity called the metabolic dysfunction associated steatotic liver disease. Just a big word for, we used to call it non-alcoholic fatty liver disease. Non-alcoholic, just to distinguish it from those that take alcohol. Okay, so we found out that there are some individuals where you find fat in their liver, and when you ask them, they've never taken or abused alcohol, but they still have fat. But it's because they have some other risk factors that is making them accumulate fat in their liver. And some of those factors include things like diabetes, obesity, then abnormal levels of cholesterol in the blood. So there's something we call metabolic syndrome, in which the individual is overweight, okay, or obese, has hypertension, has diabetes, okay, and has increased level of cholesterol in the blood. When we talk about cholesterol, we've actually divided it into the good cholesterol and the bad cholesterol. Okay, so the good one is the HDL cholesterol. The higher that one is, the better for the body. But the LDL cholesterol, which is called the low density lipoprotein cholesterol, is actually the bad cholesterol. So this condition can also lead to cirrhosis and cancer of the liver. You can see that diagram there, comparing the normal liver with the fatty one. You can see the fatty one that is appearing yellowish. Okay. Next slide, please. So this is what the liver looks like when cirrhosis occurs. It becomes riddled with, apart from being fibrotic, it becomes riddled with multiple nodules. You can see that when you compare this with normal liver, you can see all these bumps, these nodules there. So when cirrhosis occurs, we are saying there's irreversible scarring of the liver due to chronic damage. And there are a variety of causes, hepatitis B, C, alcohol, the ones we have mentioned, even parasites. And then when cirrhosis occurs, there are usually some complications that may follow, one of which is portal hypertension. That's, we're all familiar with hypertension. The common hypertension we know is the one we call systemic, when you say somebody is hypertensive. But there are also other types of hypertension, one of which is portal hypertension. So when there's pressure build-up within the liver circulation, okay, because the liver is fibrotic and there's distortion of the architecture, blood flow through the liver becomes impaired. And then the liver begins to, that blood, of course, there should be no stagnation. Okay, so it begins to look for other places to flow. So there are some veins, especially the ones along the food passage, that are closed since early in life. They begin to now open up, and they give rise to conditions we call varices. So those varices, the thing about them is that they are dilated veins, because blood that is supposed to flow through the liver is not able to flow well, so they begin to open up. And one of the fallout of that is that the person can vomit blood. That's what we call variceal bleeding. And of course, the liver produces albumin, an important protein. That albumin is one that enables us to be able to maintain fluid within the blood vessels so that the fluid doesn't flow into cavities. Okay? So when the albumin production is low, it also makes fluid to flow into these cavities. One of them is the abdominal cavity, and the person has abdominal swelling. So the swelling, the abdomen swells up because of fluid, excessive and abnormal accumulation of fluid. That's what we call ascites. Next slide. Okay, so liver cancer, of course, is quite common in our environment. It's the fifth most common cancer in the country. It often arises from chronic hepatitis B and C, or from cirrhosis. Of course, we say cirrhosis can be from any cause, a variety of causes. Okay. So, but the unique thing about hepatitis B is that hepatitis B can directly cause cancer of the liver, directly, or it can cause cancer of the liver by first causing cirrhosis. So it can go two ways. Hepatitis C, for instance, doesn't usually cause cancer directly. It causes cancer by first causing cirrhosis. So that's why hepatitis B has been shown to be a cancer-causing virus. So this one is gone. And at that point, the person needs another liver. And of course, there's no place in the country where liver transplantation is gone. And at that point, the person needs another liver. And of course, there's no place in the country where liver transplantation can be accessed. So it's better to prevent. If anybody wants liver transplant now, he has to go outside the country, and the cost is prohibitive. You also need a suitable donor. So drugs and herbs, this is very important. A lot of our people take herbs. Some people nurture their children with herbs from until adulthood. I mean, it's so common in our environment. You see the herbs being hawked by the roadside, and it's causing a lot of damage. It's causing ill health for our people. The liver metabolizes drugs and other toxins, including herbs. So it gets damaged by some of these drugs and herbs and causes what we call drug-induced liver injury, DILI for short. Okay? So the damage is sometimes dose-dependent, either dose-dependent or idiosyncratic. When we say something is idiosyncratic, it means it's unpredictable. But the dose-dependent means that the higher the dose of what you take, the greater the risk of damage. It may interest you to know that the common paracetamol that we are all familiar with is potentially injurious to the liver. Okay? So we shouldn't abuse painkillers. We shouldn't abuse drugs at all. We should avoid self-medication. Because some of these drugs are potentially injurious to the liver. Some antibiotics, some antihypertensives actually can cause chronic liver disease. So the treatment often in this case is to avoid the drug, and the liver will usually recover, provided the damage is not extensive. For those who have extensive liver damage, then that can be fatal and cause death, except liver transplantation is given to such individuals. So the elderly, female gender, and then those who are obese, they have increased risk of having drug-induced hepatic injury. What are the symptoms of liver disease? The vast majority of people will not have symptoms. I've mentioned that. Okay, but when symptoms are present, these may include malaise. Malaise just means feeling unwell. A lot of times people just say, I just don't feel fine. They can't place their finger on what is happening. So feeling unwell may just be a warning sign that something may be wrong with the liver. Okay, sorry. Tiredness. You know, when some people, and in this part of the world, when somebody gets tired easily, they attribute it to stress. I've overworked myself. It's always good to go and see your healthcare provider if you are experiencing tiredness that you cannot really explain. Fever, of course, fever. Jaundice just means yellowness of the white part of the eyes. Okay. Oftentimes, when people have viral hepatitis, especially the acute one, hepatitis B, what they usually have are symptoms that are similar to malaria. And the people are familiar with malaria. Somebody has everything, they just attribute everything to malaria. So, but what now usually happens is that the patient has fever, malaria-like symptoms, but as the fever is now subsiding, jaundice appears. And that's when the alarm is now raised that now, this may not just be malaria. And that's when the person will now go for screening and they will discover that he or she has hepatitis. So, right upper abdominal pain. Okay, we said the liver is located in the right upper part. So, if there is something going on there, inflammation, or there's an abnormal growth, it stands to reason that it will present with right upper abdominal pain. And I've talked about abdominal swelling, especially could be from liver enlargement itself. Some may have very huge liver that causes abdominal swelling, or some may have ascites occurring. Then bilateral leg swelling, anytime there is bilateral leg swelling. So these are some of the pictures of, you can see the picture of somebody with ascites, with abdominal distension on the top left-hand corner of the screen. And we usually talk about telltale signs that we see in somebody, in a patient, that will tell us that this patient may have chronic liver disease. We call them stigmata, peripheral stigmata of chronic liver disease. In males, for instance, okay, let me start. We usually talk about starting from the head to the toe. You know, when somebody begins to have fluffy hair or brittle hair, that may be because maybe a sign of hypoproteinemia. I said that in liver disease, there might be a problem with production of protein, including albumin. So they may have brittle hair or fluffy hair. Now, some may have swelling around the cheek. We call it parotid swelling. It's also a feature of hypoproteinemia. Then coming further down, for males, you can see that male having enlarged breast. Okay, the liver plays a role in metabolism of estrogen. Now, so if estrogen is supposed to be more active in women, but it's also present in men. But so if there's problem with metabolism, they begin to have feminine features. Okay, so the breast enlarges. That's what we call gynecomastia. Okay, now there can be some spider-like lesions, vessels on the anterior chest wall or abdomen, what we call spider nevus. Now look at that harm, the redness that you can see there. Okay, the outer surface of the palm. That is called palmar erythema. That can occur. Of course, jaundice is, that picture is depicting jaundice. Other things that they can have, they can have these enlarged vessels around the umbilicus that are radiating out. Those vessels give the appearance of what we call caput medusae. Okay, if you remember the Greek goddess, that Greek goddess that has many snake-like heads. So that's what, because of that appearance, that's why it's given that name of caput medusae. And then for males, they may also have testicular atrophy. The male pattern of pubic hair distribution may become that of female. And for females, what they may experience is that they may have breast atrophy. Okay, so these are some of the things we look out for in patients with chronic liver disease, especially cirrhosis. So how do we manage liver disease? Supportive care largely. Okay, bed rest. We encourage high carbohydrate diet, low protein. You know, because you are giving the liver more work to do. Because in some instances, when the patient has liver failure, we even ask them to largely. Okay, bed rest. We encourage high carbohydrate diet, low protein. But the disease is when it begins to cause damage to the liver. Okay, so I'm not saying people with hepatitis B should not take protein. We are the ones that will tell you when you come to say, okay, whether you should take protein or not. So I don't want you to go because I hear different things. People will say they have been asked not to take red oil, not to take. I don't know where they got all those information from. So you should be careful where you get your information from. Okay, so okay, whether you should take protein or not. So I don't want you to go because I hear different things. Hepatitis B, you start the patient on antiviral therapy. If it is alcohol, you encourage the patient to stop alcohol. So you take care of the positive agent. Or if cirrhosis has already set in and you even successfully get rid of the causative agent, you must continue to monitor that patient because that patient can develop cancer of the liver. So they must be on surveillance. And the way we do surveillance is that we ask the patient to be doing abdominal ultrasound, which is cheap and safe. We are not afraid of exposure to radiation. It is cheap and safe. So you can do that every 6 months. And there's a tumor marker we also assay in the blood. We take the patient's blood and we look for what we call the serum alpha fetoprotein. Then, of course, for where they have such facilities, I don't think we have any in this country. These extracorporeal liver support devices. These are just devices that can perform the function of the liver temporarily while somebody is awaiting liver transplant. And this keeps the patient alive. A stopgap measure prior to liver transplantation. Of course, liver transplantation is ultimately another treatment modality. So how do we prevent liver disease? Okay, you need to check your hepatitis B and C status at least once in a lifetime. Of course, there are some other groups that should be checking more than that. Those groups that are at risk. Okay, especially healthcare workers, emergency care workers, Red Cross, all these people that take care of accident victims, for you to check your status at least once in a lifetime. And then vaccination for those who are not infected. Vaccination doesn't help somebody that has already been infected. So for those who are, so screening, of course, we know that smoking is associated with a lot of cancers. And unhealthy. I mean, it's associated with a lot of disease conditions that could be life-threatening. Then it's important to avoid self-medication. It is quite rampant in our environment. People are so comfortable. There are some, because of absence of regulation, ideally you shouldn't be able to get some drugs without doctor's prescription. But you know what is happening? We have patent medicine stores around. People can easily go there. We have some people hawking medications. We have something we call akape in the rural community.